Kenya, we're working with the Pokot people who live in the North Rift Valley. It's an area that's very remote, very rural, and also has very few resources available to it. There isn't a functioning healthcare system that can improve outcomes for mothers and babies. The result is that every day, mothers and newborn children die in childbirth, often from easily preventable causes.
Russia has one of the fastest growing HIV epidemics in the world, and groups in Russia that are marginalized, such as street youth, are at particular risk for HIV infection. And in fact, in a study that HealthRight did in St. Petersburg about 2 years ago, we showed that 1 out of 3 street youth living in St. Petersburg are in fact infected with HIV.
When the rebels came, so they asked us to join them. I personally said we are interested in going back to school, but not to join them. Upon saying that, they gunned down 3 of my friends in my presence, and they were dead, instant.
For asylum seekers, it's often a question of life and death, whether they are granted asylum or not. Many of them are torture survivors who, if they are returned to their country, could be tortured again. If they are not granted asylum and are deported, then they are back in the same hell that they came from.
I come from a lifetime of human rights activism, working on a whole range of human rights issues that really mattered to the people in the communities that I was working with and on behalf of. I came to a point where I realized that one of the things that matters most to people, and it's a very simple realization, is the right to health and their health of their families. It's one of the basic challenges that people face when they're poor, to try to make sure that they can stay healthy and their family stays healthy. And without that, people often are driven even further into poverty and despair and indignity. HealthRight International is founded on the principle that health is a human right, and that access to health is fundamental for strengthening and protecting other rights and liberties. And what that means is we work directly with those communities, with local governments, with partners, with advocates, and we work to identify what are the human rights problems, the health problems that they face that are most grave and serious, and what are the ways we can come up with solutions together to fix them. For example, in Kenya, HealthRight has partnered with the Ministry of Health and with local communities to bring quality maternal and newborn care to women and children who were once completely left behind. In Russia, we work with local communities and the health system to ensure that street youth have access to immediate care, as well as comprehensive services to help them turn their lives around. And right here in the US, our Human Rights Clinic has helped thousands of people who are fleeing torture find safe haven.
HealthRight projects are working across the world to decrease maternal deaths and to decrease infant deaths so that we can have healthier families and healthier communities. At a very basic level, our projects are helping to save people.
We very clearly in our programs make the connection between health and human rights, working with local partners and creating infrastructure so that when we leave behind something that is actually effective.
Human beings have a fundamental right to be free from torture, and HealthRight's work through the Human Rights Clinic helps fulfill that right.
I think we have the potential to affect change not only at the local level, but at the national and global level. And I want to be part of that change. I want to help that change happen. And I think everyone who's going to be involved in HealthRight is going to be part of making that happen.